Well, there is some bad news for those flying from Ebola-affected countries as well as flying from other countries around the world. With more on this, we have WHJ science reporter Gautam Naik, and he joins us from London. Gautam, thank you very much for being there.
My pleasure.
OK, the bad news comes as the basis of a report of the British medical journal, The Lancet. Tell us more.
Yes, there's a study done by Canadian researchers primarily, and what they've done is they've looked at international commercial flight patterns and melded that data in a pretty sophisticated model with infection rates in the heart of the outbreak, the hot zone, which includes Sierra Leone, Liberia and Guinea. And they've concluded that based on roughly the current pattern of international flights, there will be 3 cases of infected Ebola people leaving that part of West Africa and traveling overseas. It should be emphasized that 2/3 of those passengers are projected to land in countries that are either very low income or low to middle income. The danger here is that these are precisely the kind of countries that have fewer resources in identifying and tracking patients should they arrive in those places.
And fewer and actually, Gautam, to add into that, fewer resources to treat it. So getting someone into a hospital might not be to Western standards.
That's right. I think the 2 main countries that are at risk here are Ghana and Senegal. But also there's some good news lately that's come out about how Nigeria was able to stamp out the beginnings of this problem within their own borders. So it is entirely possible for countries to deal with this effectively if they mobilize resources very quickly.
And Gautam, tell us what we can learn from what Nigeria did. Yes, we can learn that they managed to do this. Was there anything that they did that the US should be looking at?
Well, the projected number of passengers who might end up to US shores is very low. As I said, the 2 countries that are particularly could be particularly, affected in terms of incoming infected passengers are the UK and France, just because that's the way the pattern of flights is.
OK, so maybe the UK and France should be learning from what's going on in Nigeria there. Now, the other thing that was interesting here is there could be as many as 10,000 new cases a week, but that's in West Africa. 10,000 new cases a week, but only 3 people really getting into Western countries.
Well, the 3 people who are expected to travel overseas if they're infected passengers, that's a sort of constant. So if the source of the hot zone shows more and more cases, as we expect it will, if 10,000 cases a week by the end of by December, as the WHO projects, turns out to be the case, or indeed 20,000 or 30,000 further down the road, then you have far more passengers potentially who are infected ending up outside the current hot zone. So the message, I think, from these researchers is that to control the potential spread of this disease beyond the shores of Africa, you have to really root it out at its source, and most of the resources should go there. One of the ways to do this is to screen at airports, which the countries are doing in Africa already. There's one problem, though, that the virus, the Ebola virus, can incubate in a person for 21 days, up to 21 days. So you may be infected with Ebola and you may show up at the airport, they may screen you for a fever, but you may not know you have it. You may be an unwitting passenger. You get on a plane, you travel to Europe or the US or anywhere else, and maybe a week later you start to show the symptoms, and that's when you can infect others. So that's the problem with this virus.
OK, well, we have to keep an eye out for all of that, and certainly all the healthcare workers need to do that. Thank you very much, Gautam Naik, WHJ science reporter.